So real quick, let's talk a little bit about the test. Really, the key to get the test, as most of you have already done, some of them that are here haven't done it yet, but the online program is really designed to pass the test. It's an educational program. It's interactive, web-based. You can actually, for a few dollars, you can get CME certificate, 12 hours or 10 hours, depending if you take the test or not. The certifying exam, basically you can get tested at SAGES and ACS every year. So that's the easiest way if you go to one of those things. But there's now 36 Fuse centers in the United States outside these two venues that where you can get Fuse tested. Usually if you have a FLS testing site nearby, we're trying to get every FLS testing site to be Fuse testing site. That's about 70. That's sort of the goal that we have. That'll be 70 sites throughout the United States. Pretty much 50 miles for each resident, at the most 50 miles to the next test center. These are the test centers for those that want to just take a quick peek that are currently available. In case you didn't want to get tested today or you live close by to one of these test centers, you can use those. There's no difference in terms of how the test is administered or what the costs are. And this is sort of to give you an idea regionally, mostly East Coast, obviously. So we have so far over 1,200 people that have taken the online curriculum. And if you go ahead and take the test, what's in it for me? Basically, you become, as you can tell already, you know, if you had this material to your disposition, you basically become a pioneer in patient safety on electrosurgery. You get access to the teaching material that we have once you have the test, and that teaching material is about 10 hours of slides that you can put together however you like for grand rounds and so forth. You become a Fuse teacher for your resident fellows or staff in allied health, as we already said. And then you qualify for SAGES support to establish a Fuse center where you are, which is very easy. It takes $200. You pay $200, you have a computer and a proctor, and for every test that you then do as a Fuse center, you get $25 from SAGES back. So your first 9 testers pay for your test center, so to speak. If you already have a FLS center, it's just a plug-in. You are the best expert witness for device cases money can buy. Let me tell you, that's true. And your entry ticket for participation in OR safety and device development, if that's something that you consider as a second career, so to speak. It assesses, the test itself assesses knowledge on basic principles, as we already said. It's field tested, validated. It's a high stakes exam. So the American Board of Surgery one day will say, we're going to make this test an MOC requirement. You already have it. There are 80 questions. It takes 90 minutes. You get the report in 3 to 4 weeks, maybe faster. It needs to be proctored and supervised, no question about that. And that's why it costs a little bit. And 70% is the pass requirement. And the pass rate is greater 80%. And I expect that everybody that was here today and takes the test will pass. I'll give you 100% on that. Who is eligible? It's validated for physicians in allied health with a minimum of 1 year or experience. So it's not for the first year residents, all right? You need to purchase a test voucher, obviously, and it has to be administered in an approved test center by SAGES. And if you have a test voucher, you have about a year to take the test. If you wait longer than a year, you'll have to start learning again anyway. So, and for those that want to jot down the contact information, Jessica that came here twice, this is how you get in touch with her. So what does it give you? It gives you, if you do the first Fuse certification, that's 12 AMA PRA Category 1 credits. The American Board of Surgery Part 2 MOC, you can use the Fuse for that. So the CME of the Fuse will count for that. That's 10.5 hours. CME credits are available on the Fuse didactic materials. At the end, you just put in your credit card numbers. I think it's $60, and then you get a certificate. We do that at the SAGES office for you. Fuse online curriculum is also eligible for nursing, CEUs. So if you go back to your hospital, tell your OR director, they can do 10.5 hours, and you would like your the nurses that work with you to be certified because you're worried about your patient safety. And for CME and contact hours, obviously the fuse test is not mandatory. So this is what, I want your name up there. I want your name on all your nurses that you work with up there, and get us some other people to do this test, because really we believe, and as you can tell probably, if you've never heard this material before, you say to yourself, why didn't I know about this? Why is this not taught in medical school? Why is it not taught during my residency, my fellowship, or later, right? We don't know about this. So there's a good reason for you to do that. Thank you very much for coming today. We all appreciate your tenacity to stay over on Saturday, and good luck if you do the test. Thank you very much.